welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook. I'm Eric Marsh, Executive Director of Whitewater Community Television. Glad to be once again joined by our doctors, Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. I started with him because he wasn't here last week. And coming this way, there's always a reason behind the madness.
I'm not offended, Eric, so...
Coming this way, Dr. David Jetmore, Wayne County Health Officer. Gentlemen, it's good to see you again.
Great to be here.
It's good to be here.
We always start off with the week that was. Doctor, the week that was.
Well, the rate, all the numbers for Wayne County are the numbers that we dreamt of a year ago. Our positivity rate is less than 2%. I think it's 1.6. There have not been any deaths reported in the month of June. An average day might have one case of COVID or less. We're one of the blue counties. I think there are 8 counties that are in yellow. So we're in a good place. And it makes me very happy.
And you look happy.
He can get back to spending more time on his motorcycle, is what he's saying.
Probably, yeah. Or chasing pangolins or something, I don't know.
Exactly.
Dr. Huth, the week that was for you at Reed, numbers hopefully are down in your neck of the woods also?
They are, but they're not zero. We've actually gone in the last couple of weeks, very short periods of time where we've had no COVID patients in the hospital. I mean, like hours, 6 hours.
Okay.
And we're kind of looking forward to the time where we can kind of declare that, we're in a new phase at least. There may still be some cases going forward that require hospitalization, but they'll be much even fewer and farther between. And so we're trying to figure out exactly what that moment is. And I think, if we go a day or 2 or 3 without any active COVID patients in the hospital, known positive COVID pneumonia patients in the hospital, that'd be a good thing. But we've not had anybody on a ventilator in several weeks, and that's a very, very good thing. When we get new cases in the hospital, I look at them all closely and kind of see, okay, who are they? What are the underlying themes? And basically, we're still kind of at the themes of people with predisposing conditions that predispose them to higher risk of advanced disease and not vaccinated. I have not seen a fully vaccinated person requiring hospital admission ever. And so I think, it just kind of really underlines the value of vaccination at preventing severe disease. It's very, very, very good for that. So, and when we get a new case, somebody with, whether it's age or, some of the other comorbidities, as we call them, the big ones are obesity, diabetes, chronic heart and lung conditions, and age are the big ones. When we get people with those combinations of those conditions and they haven't been vaccinated, I'm always scratching my head. Why have they not been vaccinated? It just doesn't make any sense to me. And, but it is what it is, and there are a multitude of reasons why people don't get vaccinated. I understand that, but thankfully the numbers are very low. I think this morning there was just one, for sure, COVID-19 pneumonia patient. And, so that's all positive. I think we're on the cusp of having longer periods of no patients, more than just a few hours. And I've always got my ears and eyes on the sort of the news, the scientific news, the output of articles and so forth. And I know that in the sort of the non-scientific media, there was a little bit of waves in the last week over a quote-unquote study that was published on a preprint server that suggested that hydroxychloroquine is very effective at preventing and treating COVID-19. And, so I don't have anything against hydroxychloroquine. If it truly were a great drug, then we'd all be anxious to use it. And we did use quite a lot of it in the beginning. But it's pretty clear that it doesn't have significant value. The good studies, the prospective, meaning they were set up to treat with hydroxychloroquine versus not treat, when you do those studies, it doesn't have value. In fact, there's a trend toward a higher mortality rate in patients who get hydroxychloroquine. Now, this study that was published in the last week was on a preprint server, which means it's not peer-reviewed. It's not actually gone through the peer review process for publication in a scientific journal. It was a retrospective review of hospital records from early in the pandemic, which many of those kinds of retrospective reviews have already been done. And it's not really breaking any new ground. It's just the timing of when this comes out. And I can tell you, I read that quote-unquote study. It is extremely poorly written. There is no way that study is getting into any scientific journal. It is totally suspect in every way. Now, you might not know that
Sure.
if you are not familiar with how scientific literature should look and so forth. And, a lot of people get fooled by these things. So if any of our viewers who are, I think, smarter than the average person out there, if you ask me, I hear from many of them, and that's my impression, is that they're kind of a cut above the average person out there. They, I think they can kind of get these concepts that the quality of the study is what's important. And when you look at the truly high quality studies, they're not good, still not good for hydroxychloroquine, and that's unfortunately the case.
What are you all doing? You're still having some cases, even though they're. What are you all doing? What is the treatment of choice in the hospital, generally
the standard
speaking, for where you
treatment
go?
Is remdesivir, which is an antiviral drug, plus dexamethasone, which is a corticosteroid drug that helps to reduce the inflammatory state more quickly. In some cases, we give a monoclonal antibody that's a specific inhibitor of the severe inflammatory markers. Mm-hmm. So it's a so-called IL-6 antagonist. So it, the theory is that it works by augmenting the reduction of the inflammatory state. We have to remember, in COVID-19 and acute COVID-19 illness, there really are kind of two phases. There's an earlier phase that's dominated by the viral infection, and that has certain appearance and consequences. Where people get into trouble is in that second phase, that the infection triggers, but is not at that point driving, which is a severe, out of control, kind of runaway inflammatory process that attacks the lungs primarily, but other tissues as well. And that's where some of these other treatments, particularly dexamethasone and the tocilizumab, which is the IL-6 inhibitor, help to reduce the inflammatory state and do offer some reduction in risk and mortality. And that is the standard treatment worldwide, really, certainly in the U.S. and the developed world. And is as effective as we can be with this at this time. I'm sure that there'll be other drugs developed that will be even more effective over time. But I can tell you without a doubt that hydroxychloroquine is not one of them. That much is very clear after numerous prospective studies that failed to show benefit. So anyway, that study was out there, and we had to do some work to kind of damper the enthusiasm over that, and in certain circles asked to comment on that for different people. The other thing is, this week there was a study that kind of touches on the infertility question, because it is still, this meme is out there that vaccination causes infertility. There's no evidence that that's the case, but there's accumulating evidence now that in fact, almost the opposite may occur. And the latest article on that was something just a research letter published in one of the journals of the American Medical Association yesterday, looking at sperm counts in men, volunteer men of college-age men, and they did this on a couple of university campuses, doing sperm counts over time, looking before, starting from before they got vaccinated to up to about 2.5 months after. And basically, in no individual case could they find where the sperm counts decreased. That's after vaccination. In fact, the average sperm count was higher later on. Now, having said that, that doesn't mean vaccination is good for men's infertility problems. Not what that means. There can be some natural variation and other things that can impact the sperm counts that you get at any particular moment. But the important thing is there's no evidence of reduction in sperm counts. So, I know that the infertility question has been mainly about women concerned about fertility. But this is just an example that there are a number of studies that are looking at that question specifically, and so far nobody's finding anything untoward regarding the vaccines. In fact,
you would think
you could argue that it's protective of fertility because there is some evidence that longer-term consequences of COVID-19 infection can include infertility. So you could argue the vaccination is protective.
One of the things we have now that we didn't have before is 170 plus million people that have been vaccinated. And you would think with that number that you would hear of fertility problems, and we're not hearing that.
Yeah, and that's a great point because a lot of people are really mining the vaccine adverse events registry system, a reporting system, looking for little things, and that's where we get. Recently there was discussion about inflammation in the heart tissue of young people after vaccination, and that was just based on very small numbers, but that's the kind of what they call a signal that they're looking for out of those databases. And I can tell you people are looking hard and fast at and prolonged intensively at VAERS regarding the female infertility issue, and there's just nothing there so far. So again, another indication that, to your point, I think, seems like if that were really a thing, it would show up in the vaccine adverse events reporting system.
Well, many of these things show up in the Facebook research laboratory.
Yeah. We all know that if it's printed on the internet, it has to be true, right?
The thing about it is, if somebody hears something multiple times over and over again from various people, it begins to take on the ring of truth. And I just think that's human nature. When you hear things over and over again, you think, well, it must be true. I've heard it 30 times. But in fact, that's not how science works. You do a prospective study like Tom talked about. You study the problem. You see if there's any influence or, what's the outcome. And to your point, there's not been any evidence of any infertility. I think we've pretty much ruled out government tracking via the vaccination, which was something that was said early on that somehow the government, I never knew how they could get the little tracking device through the needle, but that was voiced many times on social media. But this is just science. We had a disease, and the disease made an appearance. We formulated a vaccine. We tested the vaccine on 30 to 40,000 people at a time for each manufacturer. The vaccine proved to be incredibly effective, 95% effective in the case of Pfizer, Moderna, very high effective with Johnson & Johnson. We gave the vaccine, people quit getting COVID, people did not get bad side effects, and that's just, that's what happened, that's what came to pass.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We do have a guest on Zoom that we should probably bring into this discussion, although I'm not sure she wants to be part of this discussion. She's been here with us the last couple of weeks. Christine Stinson, Executive Director, Wayne County Health Department. Good afternoon.
Good afternoon. Thank you guys for having me on.
No problem. I was out at the fairgrounds a little bit earlier. I saw the mobile unit already out there, ready to go.
We are ready. We'll be out there beginning tomorrow from noon to 5. We'll be there Saturday and Sunday. And then every day of the fair from 3 to 9 p.m. we'll be out there doing vaccines.
Okay. And all 3 vaccines will be available?
Yes. We'll have Pfizer. You could choose Pfizer. Definitely if you're between the ages of 12 and 17, that's the only one that you'll be offered. And then we'll also have Moderna and Johnson & Johnson. So you'll be able to, it's a la carte, whatever you want. We have it there available.
You all had a health board meeting yesterday that will actually follow this show. If you're watching live on Friday, I should probably put that in there because it won't happen every time during replay. Talk about where the health board believes, and as a health department, Dr. Jetmore, please jump in, where you all believe we are here in Wayne County. Everybody has made some adjustments in their vaccination locations, kind of ramped down a little bit. Testing we haven't talked about. Talk a little bit about where the health department is as we go into, hopefully, a prolonged lull in COVID-19.
Yeah, and I think that it's important to remember that now is the time to get the vaccine. Before we head into the fall, we need to really drive up our vaccination rates in Wayne County. We are at just the 2 shakes of a lamb's tail above 41%. We're 41.2% now in Wayne County for our vaccination rates. We have a national goal of hitting 70% before July 4th. We're going to really need to really be getting some shots into the arms to make that. So, like I said, the health department will have our mobile immunization unit out there at the fair, doing those all next week. You can always come to the health department. You can make appointments by going to rshot.in.gov, or we'll do walk-ins. Again, we have all 3 of the vaccines, so Pfizer, Moderna, and Johnson & Johnson. The health board, we discussed different areas of Wayne County. You could go to the ISBH website and you can see where each zip code is. We can see that Centerville is kind of leading the charge in Wayne County with their vaccination rates, and followed by the town of Richmond. And then bringing up the tail end is Williamsburg at 28%. So the health board would like to see the health department going out and kind of targeting some of the lower performing communities and bring the vaccinations out to some of the smaller burgs. And we'll do that as soon as we're done at the fair. We'll take a road show up to Fountain City, to Williamsburg, out to Cambridge City, because they're in the 30s with their vaccination rates.
Talk a little bit about what people need to know to get a test at your site, because that is still a thing. There is still COVID, even though the numbers are low. There is still infection in the community. Talk a little bit about being able to get a test, and a little bit about where the health department goes. The focus for the last 15, 18 months, whatever it is, has been very heavily COVID. You all have done other things, obviously, but as that begins to change, where do you all go now? What's the next thing in public health that you want people to be aware of?
Sure. So as far as testing goes, you can still come to the health department and get tested. You do have to make an appointment. We have appointments available throughout the day. So you just have to go in there and get scheduled. For testing, you stay in your car. There are some designated parking spots in our parking lot that you'll park in that. The phone number is right there on the sign at your parking spot. You'll call, they'll come out to you, they'll do your test. We have the PCR test, which is the one that we send off to a laboratory. And then we also have rapid tests. Both are available daily. You can have one or both done. So those are things we do daily. That's Monday through Friday. We do testing from 8 to 4. We do vaccinations from 9 to 4. So we do back our vaccinations up to 9 o'clock, but we do start testing every morning at 8 a.m. Then where do we go from here? We have a lot of things that we're going to start focusing on. One of the things that if you watch the health board meeting, you'll see that we're discussing a food ordinance, which is something that's very much been needed. They've been operating without a food ordinance for forever. They've never had one. So this kind of gives the framework for everyone on how do you do food inspections, what are the responsibilities of the health department, what are the responsibilities of the business owner, and then enforcement, but more importantly, there's an appeals process that's laid out in anytime you have an ordinance. And I think that that's an important thing, that there is not only enforcement, but a way to appeal any decision by the department.
Christine,
Yes.
good to see you again. Been talking to Christine a lot over the last few days.
Yeah.
We're regular phone buddies. Wanted to ask you about, and I know this question may be a bit early because schools have barely gotten out for the summer now, but it's probably never too early to start thinking about what we're going to do to work with the schools for reopening in the fall. Are we going to change anything? Are we going to work with them in different ways? Have you already had some thoughts and discussions along those lines?
Yeah, the state has came out with guidance for the schools on what it looks like. It weighs heavily on favoring vaccinated students where they don't have to quarantine if they've been exposed to different things like that. Masking is still something that they want the schools to look at, but that will be a local decision per each school district on how they'll choose to proceed. And I think the schools will do just like they did last year, where we'll have a lot of discussion. And if we're where we are right now, which we're at actually a 1.3% positivity rate in Wayne County right now, we are not going to recommend that there is, widespread masking, especially for vaccinated students. So we'll work with the schools to also, as we start ramping back up to bringing kids back to school, have some back to school vaccination clinics for each district, just like we did last year with the flu vaccine crews. We'll have some other immunization crews out there getting the kids ready to go back to school. Because a lot of kids are still behind from last year when doctors' offices and everything were kind of closed down. So not just for the COVID vaccine, but for all childhood immunizations.
Christine, what are our daily numbers now on the average daily numbers for testing and for vaccination?
Testing is really low across. It has been for over a month, where we may be only doing 10 to 15 a day for our tests. So that's why I say, we have appointments open that day, but you do have to go in and make that appointment, only because you are coming in to get tested. So we don't want to bring exposure into the building. So we come out to you to do that. So we need you to have registered for your appointment in order for us to get you checked in and everything. But vaccines, we do anywhere between 25 and 50 a day here at our office.
I think I saw that the state is ending the contracts with OptumServe at the
Yes.
end of this month. So you can see that the state is ramping down its its testing operations as well.
Right. The one in Cambridge City will end on June 25th. That will be the last day of their operation. So that's next Friday, I think.
How much testing are they doing out in Cambridge? Less than we are, or?
Yes, a lot less. There was days that they'd only do 2 to 3 people a day. So I was very grateful that we had it as long as we did have, and I could see where it was needed. There at the beginning, we were very limited on who was doing testing. Now you can get a test a lot of different places. Including the health department, that maybe having that OptumServe isn't really what our county needs, and isn't a fiscally responsible thing for the state to continue to have a contract with.
Christine, as we kind of wrap this up, I'm going to give you a minute. Whatever you want. We're going into the fair. Obviously, a lot of outdoor events, and if we get to those, we'll run through some of those, and that has been obviously the big push, making sure whether you're vaccinated or unvaccinated, that people are outdoors. Obviously, good, healthy time. But as Executive Director of the Health Department, what do you want the community to know and think about?
Now's the time to get your vaccine. I think it's important that as we move into it through the summer months and into the fall, we don't want a replay of what we saw last year. The majority of the deaths in Wayne County occurred in the fall and winter of last year. So get your vaccinations now while we have a 1.3 positivity rate going on. The health department did recommend that we follow the CDC guidelines as far as masking goes. So if you're vaccinated and you're inside, there isn't a need to wear a mask. But if you're unvaccinated, you should continue to wear your mask, especially when you're in an indoor event, especially when it's congregated together with other people.
Okay. Christine Stinson, Executive Director, Wayne County Health Department. We will see you. I assume you'll spend a little bit of time maybe out at the fair.
I will, yes.
Okay.
I'm so looking forward to it because I didn't get to go to the fair at all last year, like everybody else. So I'm really looking forward to getting out there at the Wayne County Fair and seeing what you guys have to offer.
All right. We appreciate the time that you've given us during this. Thank you very much.
Thank you.
Talking about testing real quick, and we've got some questions that have come in, and we are taking your questions for the doctors on our Facebook page as well as on Twitter at WCTV Info. There hasn't really been a discussion here about home testing. I've seen some of those beginning to crop up, kind of COVID-19 home tests. Have you seen or heard of one that is particularly good that people should be leaning toward, or should they avoid those altogether and go to one of the places that have a physician or nurse practitioner or something that can actually handle this well? Well,
I've heard that I don't have any firsthand knowledge of these tests. I've heard that they're accurate, and they were something that seemed almost too good to be true, and when you couldn't get tested. But in this environment, you can, while I'm finishing making this comment, you can go down to the health department. I exaggerate to some degree because I'm not going to talk that long, but you can go down to the health department and be tested. So I'm not sure that they're needed at this point. They certainly would have been useful earlier in the pandemic.
Yeah, I mean, I guess I feel kind of the same way. Yeah. Do you need that? Do you need to go buy a kit when you could just go get tested for free a lot more easily? I don't know about that. But I think we also have to remember that the home test kits or the consumer use test kits, they're all available under emergency use authorization. And and so that they're not really sort of fully FDA approved. And I think if you read the fine print, what they say is if you get a positive result on this one, go get one like at the health department. I was like, well, why don't you just go there to begin with? So I don't think I would recommend them. And there's also an opportunity to be scammed. There are scams out there, people trying to sell fake kits.
Mm-hmm.
The federal government tries to ride hard on that, but they're out there, and you can be taken advantage of. So stick with the tried and true. It's so easy to get now, and including all the places that not only the health department, you can still get them through Reed if you want, and they're free. There's no charge for those, for the PCR test or the antigen test, and but you can also get them a lot of pharmacies and stuff. So there's many ways. I would do that instead.
Okay. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We've got some questions that have come in. Let's see if we can knock a couple of those out, and then we'll get to the numbers that Dr. Huth has provided this week. Could you talk a little about current quarantine and isolation guidelines for both vaccinated and unvaccinated people? What's the difference between quarantine and isolation?
Well, somebody better speak here. We're gonna.
Well, look at you. You're the public health guy. This is obviously
I read
I think,
and then I get quiet.
The current guidelines for vaccinated people are the vaccinated people basically do not need to wear masks. If you're unvaccinated, you still should continue to wear a mask and socially distance. What was the second part of that question? Can we see that?
Can you put the question back up?
Between quarantine and isolation.
Steve, can you put the
And how
last
does
question
that
back
work
up, please?
within
Thank
the
you.
context
What's
of
the difference
vaccination?
between quarantine and isolation?
Well, quarantine is no contact with anybody for 14 days, and I'm not sure I know the answer to this question. The difference between quarantine and isolation. I wish we had.
Well, quarantine is for when somebody's isolation is for when you're actively sick with COVID-19.
Okay.
Quarantine
so you're not
is
gonna
when
infect
you're
anybody.
a close contact.
Quarantine's a close
And I
contact.
think
So
in the context
Yeah.
of vaccination, how do the quarantine and isolation rules apply? Well, if you get actively sick with COVID-19, whether you're vaccinated or not, you're still going to isolate. In theory, I mean, you're much less likely to get COVID-19, but should you get it, you would still need to isolate. Mm-hmm. If you're a close contact of somebody, but you've been fully vaccinated,
you don't
then
need
you
to
don't have
quarantine.
to quarantine. Is my understanding.
That's true. That's the CDC guideline, and that's one more reason to get
Absolutely.
vaccinated.
Okay. We had a question called in a couple of days ago. I want to see if we can get that one brought up. Next question up. In cases where people have been vaccinated and still contracted COVID, are their symptoms the same as what an unvaccinated person would experience, such as loss of smell, fever, etc., or are they different?
I think the symptoms are not different in kind, but they can be different in severity. And the people who are vaccinated tend to have less severe, if they still get COVID-19, have less severe symptoms. And this is where, like you remember when we've ever discussed the efficacy rates of, say, the Pfizer vaccine, which is 95% effective. Effective at what? Effective at preventing severe disease. You know what I'm saying? So basically the vaccines all of them appear to basically shift people down. A lot more people who may have had asymptomatic disease can't get infected at all. People who might have had minimally symptomatic disease either can't get infected at all or potentially could have asymptomatic carriage for a period of time. But importantly, at the worst end of the scale, people who are vaccinated tend not to get severe enough disease to need to be hospitalized and may only get minor symptoms that can be treated as an outpatient. That's kind of the working mental model on what the vaccines do. We used to say that we weren't sure if they meant that you couldn't get infected at all, because that's not really what the phase 3 studies looked at, and that they were looking at symptomatic disease rates. But there is more scientific evidence that, in fact, fewer people can get infected, period. So there'll be more studies like that to come out to validate that, but, so that's really the answer to that
I
question.
think the important takeaway is if you're vaccinated with, say, Moderna or Pfizer, you've got a 5% chance of getting infected, but your disease is going to be very mild, and there's a 100% chance you're going to be able to avoid the hospital or the intensive care unit.
I think that's the way to look at it, and hope that answers the question. Not sure. I tend to ramble a little bit,
too.
so I will stop.
Okay. We've
go
got
on.
one more question,
Yes, we all
and
know.
then we're going to get to the numbers that you're providing us for this week. A little different look at some things, I think. So let's do this question. And this is the one that we got phoned in to us a couple of days ago. Regarding 30 days after vaccination, could tachycardia, hopefully I got that right, arrhythmia, and or myocarditis? Carditis be attributed as side effects to the vaccine in any elderly patient? Do you know of any elderly patients in the area experiencing, should be probably, these side effects?
I don't think I'm aware of any in this area, and all the news and the focus in terms of myocarditis, which is inflammation of the heart muscle, related to vaccine, has been with, basically teenage boys particularly. Does that mean it can't ever happen to an older person? No, but it's a much even more rare thing. I had this kind of conversation with one of our cardiologists, Dr. Haste, in fact, and you can imagine in his practice that they see a lot of people who get sick, some of whom recently had the vaccine. They have people with established heart disease who, they have a certain rate of getting acutely sick, whether it's with some kind of heart problem. And when that happens, after they've had the vaccine, the question is, did the vaccine influence this somehow? And there's no way to know for sure on the basis of just looking at their one patient or a very small number of patients they may see that fit into that model. That's why we always report these things to the Vaccine Adverse Events Reporting System, so they accumulate the data and can analyze it to see if there's what they call a safety signal on that topic. And I've not heard it for older folks with heart disease. Our cardiologists really don't do children. So the 99+% of their practice are people are adults, particularly older adults, and they have seen some patients who got acutely sick with whether it's a heart attack or rhythm problems or whatever, and they had a COVID-19 vaccine within a period of time before. But how do we know whether that caused their issues when they were prone to that anyway?
Wouldn't the 30 days out make you think it's less likely due to the vaccine side effect? I would, because the other side effects occur within 24 to 48 hours.
Right.
But I'm certainly not a cardiologist. But I agree with you. After you've had that vaccine, it's a big moment in your life, and anything that happens to you afterwards, you wonder, well, was it because of the vaccine? It's hard to sort these things out.
That's why we don't have a way of knowing. We always report them, but so far I've not heard of any analysis showing a safety signal on those topics.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, streaming on Facebook Live. We're down to our last 18 minutes of the show, not just this show, but the show. We'll get to that in just a couple of minutes. But first, let's go to the numbers from Dr. Huth.
Sure.
What are we looking at this week?
I've shown maybe a version of this before. It's updated through last weekend. I didn't have time to do it through today, but I do it at the beginning of every week on Monday, so it's basically representing to the weekend. On the left-hand side, you can see that the lowest line is this region, this part of the state, compared to Indiana, Ohio. You know, this region, in our minds, includes a couple of counties in Ohio. So we're compared to Indiana, Ohio, and the U.S., and that's on the vaccine starts. What percent of the total population have had at least one dose of vaccine? And you can see that this region really still continues to lag. We're under 35% have started on vaccination. On the right-hand side, the low line is all broken out by county. Henry County is highest. And interestingly, I had a conversation with the health director in Henry County about 10 days ago. I'm like, how'd you all get to have such good rates and keep them up there? And she said that she actually thinks a lot of their numbers are from the prison that they've got. They have a lot of nursing homes, and then they have the prison that has over 3,000 inmates. I think that's the number. Mm-hmm. And it's a small rural county. So, and there's actually very good uptake of vaccine amongst the prisoners in that prison and in the county jail, she said. And then, of course, the nursing homes all have very high adoption rate by the residents in the facilities. And she thinks that actually kind of gives a little disproportionate effect. Otherwise, they're not doing really anything different than, say, Wayne County is. But that may explain why Henry County is relatively high, but still below the Indiana rates. And then we see all the other counties broken out there. But there's a different way to look at these numbers, and if we only look at the vaccine rates, that I think there's a growing recognition that may be kind of an incomplete way to look at immunity in the community, because we have to realize that, we can just look at vaccine rates if we want, but the reality is a lot of people have had the illness and have some level of immunity related to that. We think that that's kind of partial. Maybe not as high or as durable or as consistent as you get with vaccines, but it's there nonetheless. It's unusual, for instance, for somebody to get COVID-19 a second time within about 3 months of having it the first time. At any rate, in the second page there kind of gets at this idea, and this is just one person's sort of thought experiment, mine, and so we should not take this to the bank. But if we look at the full vaccination rate now, this is a little different focus. We're talking about people who've got complete vaccination series, and in Wayne County, that's this morning right at 35% are fully vaccinated, 35% of the total population. But when we also recognize that there are a lot of people, the county was attributed this morning with about 7,600 recorded infections. The CDC thinks that we actually undercount across the country. Infection rates are undercounted by 75%, meaning there's probably about 4 times as many actual infections as there are recorded ones. And if that rate holds up in Wayne County, then we have about 30,000 people in Wayne County who probably actually had infection. Roughly speaking, it's an estimate. Some of those people also get vaccinated. So they're all there. We don't want to double count them. They're in the 35% already. So if we think about there being the overlap like that, when you add in those who never had infection and are fully vaccinated, and those who had the infection and did not get vaccinated, what those graphs would suggest is that Wayne County is probably about 65% of the population has some level of immunity. We'd like to get everybody fully vaccinated, but 65% of at least partial immunity. And that actually compares favorably. If you want to put the graphs back up, you can see that actually is not that far off from the state numbers using the very same mathematical modeling. The
Can you put that second graph back up, please? in the
The
control
state-
room?
The state's at 69%.
Second page.
There we go. The states is about 69%, looking at that same thing, and so is the U.S. You know, so I think there's actually reason to have a little bit more confidence in the immunity in the community than you would get just by looking at the vaccination rates, is my only point. Now, does this even make sense? This is one person's thought experiment, mine. But on a phone call on Wednesday with the state where I asked this question of the chief medical officer for the State Department of Health, Dr. Weaver, I said, have you all done any modeling on this? And kind of making estimates of how much immunity is out there from infection and what does that imply for total immunity? And she said that they are doing some internal modeling, kind of using the very same parameters I just discussed here,
Okay.
assumptions into it, and but they're not sure they want to talk about it publicly yet because they don't want to discourage people from getting fully vaccinated, because people will only half listen and hear that we're at 65%. Immunity and conclude that they don't need to worry about getting vaccinated, and that's not really the message they want to send. But to me, that was kind of validation that the thought process is probably, reasonably close. So I feel confident enough to bring and share it here. But I do want to caution our viewers that these are in no way any kind of official statistics any place, so you use this information at your own risk.
And we still don't know, or do we know, have either of you seen in the literature that you've read, kind of how robust the immunity is for a person who had COVID? I assume it varies from person to person. I don't know whether it varies based on how severe their case was, or even what the trigger is.
There is a relationship to the severity of the case, somewhat, and that's a part of what drives the variability in antibody levels that can be detected in people. In addition to that, there's some evidence that after natural infection, the antibody levels begin to drop off around 3 months in, which has informed the CDC's long-standing guidance that people who are re-exposed within 90 days of having had COVID-19 themselves don't have to quarantine and case investigate and so forth. And but what's coming in now is that as we go along, people are being followed for the durability of their antibody levels, and it's actually probably a lot better than 3 months to have adequate or reasonable levels. So, I don't think we should look at, it's wrong to look at natural infection as the way to become immune. That's an awfully hard way to go, and you risk, running into long COVID symptoms, which more studies are coming out on that it's a significant problem, that a pretty high proportion of people have at least some symptomatology many months after having had COVID-19. And there are long-term questions that we can't answer right now. What is the real impact on things like, fertility that we discussed before? Are there any long-term heart problems that can happen, or kidney problems, or brain problems, all of which are under investigation? And so we should not conclude that natural infection is the way to go to get immunity. Some people will try to claim that, but I think it's a lot easier, safer, better levels, more durable with vaccination.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We are down to our last about 8.5 minutes in what is, I don't want to say our hope is that this is the final show, that things do not get bad enough that we have to reconvene this group But for right now, we are going to bring this program to an end. You've been hearing the infection rates are low, people are getting out. We think there may be more immunity in the community than we have just from the numbers of vaccinated people. So the doctors want to play, well, this one wants to play a little golf. This one wants to ride a motorcycle. They want to head into their weekends a little bit more, and we want to thank them. But before we get out of here, I want to give them each a couple of minutes to, I just want to give them each the floor for a couple of minutes and let them speak as they feel they need to the community. And we'll start with our public health officer, Dr. David Jetmore.
Well, it's been what is this, our 63rd program or 62nd? I've lost count.
Yeah.
I want to thank Eric for hosting this show and putting up with Tom and I over these many months. I want to thank WCTV for providing this forum. I have to thank Steve and Ryan for getting me through the few times I hosted the program without screwing it up completely. I want to thank Christine at the Health Department and all the people at the Wayne County Health Department, which incidentally is the best health department in the state of Indiana. And lastly, I want to thank my long-suffering wife, Sherry, for never having gone a day in these many months without hearing the word COVID many, many times. And I want to thank the people of Wayne County for all that they've done to stem this pandemic, the people that patiently wore their mask and distance from one another, and most of all to the people that have bared that shoulder and gotten vaccinated. It's been an honor to be your health officer and to appear on this program. Thank you.
Dr. Hu.
Well, gosh, many of the same kind of sentiments. And I guess I just want to say I'm incredibly proud of the great working partnership that I've had with Dr. Jetmore and Christine, that Reed Health has had with the Wayne County Health Department and through this whole crisis. And I really think it's made a difference in terms of improving the health and outcomes in the community. Our death rates, as an example, are significantly less than what should have been expected by the statistics, and part of that is people being cautious and trying to follow the advice that we've been giving, and I really appreciate that, and incredibly proud of the community for stepping up and doing as well as we have, and we have a lot of great supporters out there who've been out there spreading the word beyond what Dr. Jetmore and I have been able to share here, and I really appreciate that. I really appreciate you, Eric, for inviting us to do this. I swear I remember you saying it would be one time and you'd leave us alone, but here we are a year plus later. And
That's how he lured us in. It was a one-time
yes.
gig. He
Can
assured
I
us.
get one of your hours during the week?
But it's been a lot of fun, learned a lot, and along the way, and feel like with your partnership, we've made a big difference in the community. But you know, at a certain points, you sort of have to think about what's the best way to move forward. And this show's been great, but there are probably some different ways that we can, you know, iterate out into some other endeavors that aren't necessarily all COVID focused, and we're talking about doing that. So this may not be the last time you'll see Dr. Jetmore or me on television. We'll see.
No, it won't be.
And I want to thank my boss, Craig Kenyon at Reed Health, for allowing me to spend a lot of time on these types of activities. It's been fun and interesting, a little stressful occasionally, but that's okay. And I feel like we've, really am thankful for the opportunity to be in the position that I am to help make a difference in the community. Wasn't expecting that, but it was. There's nothing like a good crisis to kind of find out what kind of mettle you have, and so I think we've all stepped up admirably. And then, like Dr. Jetmore, I want to thank my long-suffering wife, Mary, who is, I know, very sick of hearing about COVID-19, not just on television, but she has to hear me discuss it all day long on the telephone and on Zoom calls and every which way. So she's kind of my rock and reason why I do things, and and I really appreciate her. And we had our 38th anniversary yesterday.
Nice. Happy anniversary.
Thank you. We're looking forward to many more, and we've got some. A couple of our kids are getting married this summer. Looking forward to that. So it's all good. But we'll look forward to chatting with you, Eric, in the future, and doing some other things with WCTV.
If you all think I'm going to let you all out of here without getting you back in here in some way, you haven't hung around WCTV long enough. Dr. Hugh, Dr. Jetmore, on behalf of the community, let me start by saying thank you. I'm sure these hours, 65, 80 hours, whatever it is in the long run, working on slides and things of that nature, have taken a lot of your time over the last year and a half. And first of all, we are grateful that you all were willing to give up your time to come in and do this on a live basis. To the folks that have handled things in the director's area, Ryan Harris, Steve Bonwig, graphics, and if you've ever watched it on Facebook, you've seen information come up during the show. Michelle Thompson, Caitlin Ballard, handling those things. To the folks behind the scenes, thank you very much. To the community who have watched, who have spoken to us, who have called, who have sent questions, thank you. We appreciate you all tuning in to Whitewater Community Television to let us help get through this time in our community. To my wife, who has heard a lot about this also, thank you. You've put up with a lot. So, again, thank you. Thank you very much. And hopefully we can find you all another vehicle where you all can share your knowledge with the community. And I also need to thank Jason Troutwine, who on a few occasions sat in for me as a host along with Dr. Jetmore. A couple of things we want to get you to do before we get out of here. First of all, Whitewater Community Television is trying to hear from you. We want to try to do better with what we do. We need to know what you think. We have a survey on our Facebook page. We also have a survey on our Twitter page and our Twitter feed. We have a survey also that you can find on our website, WCTV.info. We'd like you to take that survey, provide us with some information, so hopefully in the future we can do better for you, and we definitely want to try to do that. The Juneteenth celebration at Ivy Tech is tomorrow. Lots going on there. You can find out more information by going to the Ivy Tech website. The Model T Museum is having their Roaring 20s Model T Homecoming. That is back in the community, and that is taking place this weekend. Go and have some fun in the Depot District with that. Richmond Parks and Recreation Department Neighborhood Movie Series continuing tomorrow night at the Wayne County Fairgrounds. Get out, enjoy the fair, stop by the mobile unit, see the doctors. Thank you very much for watching Ask the Doctors on WGTV Channel 11. As always, I wish you well.